Cindy is a person who easily affected by others. In secondary school, she gets to know Moon, a girl who starts smoking since 14 years old. One day, Moon invites Cindy to try to smoke together.
Hey, Cindy, do you want to try to smoke? You will be addicted with this feeling. It is a well-trying in your school life.
No, I don't want to try it.
So timid.
After Cindy refused Moon's invitation of smoking, Moon felt angry. However, Moon did not give up. She always incited Cindy to smoke.
Cindy, let's try. You will not be disappointed after you try smoking. Then you will feel relaxed when you are smoking. It is a good option to help you to relax.
Moon invited Cindy again and again. At that time, Cindy has a lot of stress on studies. She starts to curious about smoking. Does smoking really can help me to release my stress? Then, Cindy starts to attempt to smoke with Moon. She is addicted with smoking after that. There are some major reasons if smokers start smoking. The first reason is stress on studies. For example, Cindy wants to release the stress on studies, so she starts smoking with Moon. The second reason of smokers start smoking is curiosity. The people feel curious about the feeling of smoking, so they try to attempt to smoke. The third reason of smoking is peer pressure. Most of the teenagers try to smoke because they do not want to crowd out from their team. The next reason of smoking is modeling family's behavior. The parents and siblings have smoking habit, it is high probability for teenagers to smoke as well. After a few years, Cindy found that her sight become blur and her teeth become brownish.
Are you smoking?
Yes, already 15 years.
In fact, smoking will bring a lot of significant effect to your health. Smoking will bring the effect the central nervous system. One of the ingredients in tobacco is nicotine. Nicotine is extremely habit-forming, so people will feel difficult to quit smoking. Nicotine can impair your cognitive functioning and make you feel anxious, irritated, and depressed. It also can cause headaches and sleep problems. That also bring the effect to the respiratory system. When you inherit smoke, you will taking in the substance that can damage your lungs. Along with the increase of infections, people who smoke are at the high risks of chronic non-reversible lung conditions. A smoker has 20% high probability to develop lung cancer than the non-smoker. The example of chronic non-reversible lung condition is emphysema, the destruction of the air cells for your lung, and also chronic bronchitis, which is the permanent inflammation that affects the lining of the breathing tubes of the lungs. And last is chronic obstructive pulmonary disease (COPD), a group of lung disease. The third effect is toward cardiovascular system. Smoking will damage entire cardiovascular system. Then nicotine causes blood vessels to tighten, which restrict the flow of blood. Next, smoking also raises blood pressure, weaken blood vessel walls, and increase blood clots. Together this raises your risk of stroke. The next effect is about integumentary system. The more obvious sign of smoking involves skin changes. Substances in tobacco smoke actually changes the structure of your skins. The high frequency of smoking will increase the risk of squamous cell carcinoma, which is a type of skin cancer. Meanwhile, smoking will also cause the increasing of hair loss, balding, and graying. Now, I will talk about the effect of smoking on digestive system. Smokers also have higher risk of pancreatitis cancer. Even people who smoke but did not inhale faced an increased risk of mouth cancer. Smoking also has effect on insulin, making it more likely to develop insulin resistance. That puts us increased risk of type 2 diabetes and its complications, which tend to develop at a faster rate than in people who do not smoke. The last is sexuality and reproductive system. Nicotine affects blood flow to the genital areas of both man and women. For women, it can result in sexual dissatisfaction when decreasing lubrication and the ability to reach orgasm. Smoking may also lower sex hormone levels in both men and women. This can possibly lead to decreased sexual desire. Second-hand smoke. Second-hand smoke is the combination of smoke from the burning end of cigarette and the smoke breathed out by smokers. Second-hand smoke contains more than 7,000 chemicals, of which 100 are toxic and about 70 can cause cancer. In addition, there are 37.1% of Malaysians are exposed to second-hand smoke at home. There is no risk-free level of second-hand smoke exposure. Even brief exposure can be harmful to health. The harmful effect of second-hand smoke bring to non-smoker is ear infections, respiratory symptoms like shortness of breath and acute lower respiratory infection. Now, do you know the serious effect of smoking and second-hand smoke? So, you should quit smoking because smoking already bring a huge harmful effect to your lung.
After listening the advice of Dr. Cindy decides to quit smoking in order to keep her body healthy. From that day, Cindy tried to keep decreasing the frequency of smoking. However, she always cannot escape from the addiction of smoking. Cindy's parents see the situation of Cindy. They decides to help her to quit smoking.
Mom, Dad, quit smoking really difficult for me. How can I do? Don't worry, we will suggest you some ways to quit smoking.
The first way to quit smoking is preparing for quit day. There are two ways to quit: either quit abruptly, which is continuous smoking right out until quit day and then stop. The second way to quit gradually, which is reduce cigarette intake slowly until quit day and the stop. For the preparation of quit day, smokers should throw away all cigarette. Meanwhile, they also can plan to attend a stop smoking group and sign out before quit day. They also should ask friends and family who smoke not to smoke around them. Most of the smoker, while they start to quit smoke, most certainly will feel the urge to smoke many times during quit day, but it will pass. Following action may help to battle the urge to smoke. First, is delay until the craving passes. The urge to smoke often comes and goes within 3 to 5 minutes. Second is deep breathe. Breathe it slowly through nose for a count of 3 and exhale through mouth for a count of 3. Visualize lungs filling with fresh air. Next, is drink water sip by sip to beat the craving. Last is do something else to distract attention, such as go for a walk. Remember, the 4D can often help to move beyond the urge of smoking to like out. Next way to quit smoking is get consultation from Smoking Cessation Clinic. And the consultation has been open to everyone for a long time. There are a total of 731 public smoking cessation clinics, and 46 hospitals provide smoking cessation service in Malaysia. Moreover, public smoking cessation clinic will only charges for 1 to 5 ringgit for consultation. So the method done by clinic or hospital to make quit smoking is through nicotine replacing medications such as chewing gum. And the second method is behavioral therapy. It is including the counseling season provided by smoking cessation expert for smokers. All this treatment is follow a specific guideline G.
Oh, Cindy, do you understand the proper ways to quit smoking?
After Cindy listens from her parents about the proper ways to quit smoking, she starts the journey of quit smoking.
Oh yeah, finally, I have successful to quit smoking.